Hi, my name's Trish Rathie. I'm a GP currently working in Toowoomba, although I've spent several years working as a GP in the rural communities. Domestic violence is extremely difficult to manage as a GP. And I think I need to start off by saying that there's no easy solution, that it's challenging, it pushes your buttons, well, it pushes my buttons. Often you can suspect domestic violence is present, you can confront the patient with it, they may even leave the relationship and escape and be placed in a place of safety, only to return 2 weeks later. And so with part of domestic violence is actually understanding the cycle of violence, and on the website of GP Connections there will be a link regarding the cycle of violence and also some resources about that. When I am seeing a patient and I suspect that domestic violence is present, you can be in that dilemma of, do I actually state this? What's going to happen if I state it? Will the patient find this negative situation? And so I find it helpful to actually, having heard the story, say to the patient that, I'm really unsure of whether or not it should be stating this, but many of the things that you're saying to me are raising alarm bells. And if I was actually using this in a teaching situation, I would actually be saying that this is an example of domestic violence. What do you think of that? And so by doing this, I'm actually making, I guess, a reflection that the behaviour that they've expressed is concerning to me, and that other people would call it domestic violence, and then giving them the opportunity to say yay or nay. The next part of my discussion with them, I actually go into a little bit about domestic violence and education regarding that, and what are the forms of domestic violence. And the trouble is that so many people actually think that domestic violence is only physical violence. I actually think that more harmful violence is actually the psychological damage that can occur. And there can be sexual domestic violence, there can be financial violence. So there's many different forms of domestic violence, and it's not just purely he's hitting me, but that living in fear whenever their partner comes home, living in fear that they're becoming socially isolated because their partner is actually having power over them. And so showing them that domestic violence is all about power, of one person in the relationship having power over the other, can be actually really, releasing for the patient, because all of a sudden they see they're not going mad, and that this is an opportunity to then discuss options for help. It's extremely difficult at any time when you're seeing a patient and you're talking about domestic violence to actually start talking about help that's available. Particularly so in a rural community where you're aware of, you're often treating the perpetrator of the domestic violence, especially so when the perpetrator may actually be in a position of authority within the rural community, of actually how do you access help. If their best mate's the policeman, then actually ringing up the local police is not going to be advantageous. If their husband's the lawyer, then there can be issues around that. A lot of times the victim will think that nobody will believe them because their partner, the perpetrator of the domestic violence, is such a fine, upstanding citizen, and they cannot believe that that anybody would actually listen to them. And so as a GP you can actually have an important role to play by challenging, and usually it is the woman, challenging the woman that this behaviour that's occurring to them is unacceptable. I usually recommend actually talking to somebody else within the practice, and most importantly is to actually establish patient safety. And so how safe are they going to be in that situation? If they're in a situation where you're in fear of their life, then involving the domestic and family violence prevention unit and ringing up. And again, at GP Connections, there's a list of phone numbers that you can contact with that. There's actually a 24-hour helpline that's available all over Australia, so that you can ring that. And they can actually organise for for one of your patients to be removed from that situation, usually under the auspice of the police. However, if it's a member of the law enforcement community involved, then other considerations and options may need to occur. So first of all is actually after you've talked to the patient about domestic violence and got them to see that yes, they are in a situation and they are a victim of domestic violence, is to work out a safety plan so that at all times they are safe, taking into consideration children. I actually like to help work out a complete safety plan for them, so that if they did need to escape, and I guess it's an escape plan, if they did need to escape in the middle of the night, they actually had all their documents, they had medications, they've got their social security, they've got their bank details, they've got passports, they've got copies of all of those things that they can just put their hand on and go. And so actually helping them through that. I put them in contact with the Domestic and Family Violence Prevention Unit, and will actually give them the phone number so that they can contact and have a phone consult with that person, particularly so in the rural communities. And so they can actually talk to this counsellor over the phone and discuss their options. Your patient may choose to stay in this domestic violence situation, and I always maintain that the patient has the right to make the wrong decision. And that your job as the GP is to empower them, to continue to care for them, but to respect whatever decision they may have. And so if the patient does decide to stay in this situation, continually reinforcing the importance of safety, the importance of having that escape plan. And just doing those things can actually empower the patient so that no longer they feel trapped, but they're actually staying in this situation and it is their choice. You may find over the course of time that they actually do move on and that they are able to leave that relationship, or they are able to actually change the dynamics within that relationship, and so that they are less a victim. I think either way, it's something there's no quick fix situation. It's extremely difficult. It will be one that you will rehash with that patient time and time and time again. And I think of some patients that I've cared for that 5 years down the track from when I've had that initial conversation with them, they are still in that relationship and they're still denying that anything's going on. Just continuing to make yourself available to care for them, I think is really important. And again, being aware of the buttons that are being pushed in yourself and looking after yourself and talking to somebody about it, particularly in the very violent situations or the ones where there's a lot of psychological harm occurring. Don't take that on board. Remember, it is the patient that is the one with the problem, and making sure that you care for yourself. Hopefully you will never need to avail yourself of the Domestic and Family Violence Prevention Unit, but knowing that it's there can be really important in knowing how to contact them. And again, on the GP Connections website, they'll have all of those details. So thank you.